Forensic nursing came out of a desire to provide higher quality care and not to re-traumatize our patients. There are a huge number of people who are impacted by sexual assault every single year. We know about only a fraction of them. And so the research that we are doing, the goal is to make sure that everyone can access high quality patient-centered care wherever they are.
One of the projects that my team is working on right now is a decision-making tool to help patients and providers, so nurses or physicians who work with patients after sexual assault, make the decision about whether or not to take a medication to prevent HIV. When we talk to patients about these medications, that the conversations were difficult to have because we didn't have good guidelines from places like the CDC on what needed to be included in those conversations or how to have those conversations. And so the purpose of this project really was to create some standardization. And so the tool is an internet-delivered tool to help standardize the education that patients can receive around what is HIV, what are these medications, how do they work, what is the purpose of them, and then what are some of the pros and cons of deciding to take them or deciding not to take them so that patients can feel confident in the decision that they ultimately end up making.
Our goal long-term is to get you a forensic nurse in your pocket. And then the actual intervention itself is a series of pairwise comparisons about what's most important to you. Is it preventing HIV or protecting your privacy? Is it about making sure you have good social support or not feeling sick from side effects? And so depending on how people rank those different priorities, they actually get personalized feedback from the intervention. And so helping to guide the conversation supports our clinician colleagues as well as the patients who are making the decision.
My role on the team as a qualitative expert is to really dig into patients' experiences of healthcare visits following sexual assault. So what I do is look into these conversations, look into these interviews, and see what it is that patients are really needing and how can we put this together to present it to other healthcare providers to educate them on patient-centered trauma-informed care.
We're at the tail end of a study right now where we interviewed lots of providers and patients, and I have now been working on data analysis of those interviews. And some of our main findings so far is that patients and providers both really feel that the tool has a lot of usability, it's relevant to the work that they're doing, and it's really needed.
At District of Columbia Forensic Nurse Examiners, we really value our partnership with Jocelyn and Jessica. This is going to be really helpful in making sure that patients have all the information that they need to make an informed decision at a time where they might be overwhelmed with emotion and information. You get to work together with a patient to develop a care plan based on the circumstances, but also based on what they want. So it's really collaborative.
We believe that the research is now in a place to where we are able to reach more vulnerable and underserved communities to help them navigate the healthcare services that are available to them following a sexual assault. Because we know that this is a sensitive experience and some of them may not have the resources or capabilities to reach out for help.
A lot of our work so far has been really focused on when you're with the forensic nurse, this is how we can make that interaction better. Now we're looking at how can we improve intermediate outcomes? How can we improve patients' long-term mental health is the most important thing we do.
I think a lot of times what the nursing scientists and nursing clinicians are looking at are those more acute moments, that right after effect, which is obviously a huge piece of it. But as a trauma therapist, what I've seen the most is that long-term effect, the years later when I'm talking with someone about it. And so I think those perspectives can be really helpful when they're used in tandem, we get a much fuller holistic picture about better interventions and better prevention efforts when it comes to anything from trauma, sexual violence, to childhood trauma, etc.
Another project that my team is working on is an epidemiological cohort study. So one is a cohort of sexual assault survivors who seek care in that first handful of days to a sexual assault nurse examiner and receive care. And the other cohort is a group of sexual assault survivors who do not seek acute care in those initial days. So by following these cohorts, we're hoping to look at what impact seeking care has on health outcomes, criminal justice outcomes, as well as their future health care utilization. So we're really excited to be able to see some of those things over time that have not been looked at previously.
We do need more forensic nurse scientists. We have a national shortage. There are not enough of us out there in practice, and we need more people to help us build this evidence base so that more patients can benefit from the care and the services that forensic nurses provide.
My favorite part about being in this field is that I get to think really big picture. What are the really hard problems that we're facing? And starting to figure out where we are and how to tackle pieces of them is really important, because that's how we can begin to make changes.
The kind of research that they're doing is applicable in so many areas, like social work, or in even like ER nursing, or in public health, or even in HIV research. And so there's a lot of overlaps, a lot of intersections that I think is just a really cool and rewarding thing.
I'm really excited about forensic nursing because I work in the field in the emergency room. And so where I work right now, there's really not policies and procedures in place. And so I get to be kind of at the start of that and see how I can use research to make sure that we're doing the best evidence-based procedures for our patients to help them through a difficult time. I've been able to apply for an NIH grant. I've been able to go to international conferences, and no one in my department is able to do that. So without Dr. Anderson as my mentor, I don't think I would have had those opportunities.